Okay, it is now 6 p.m. Good evening, ladies. This is Dr. Nelson Garais. This is MED210 6NAX, and it is now week 2. So what's due today? Task 1, discussion 1, lesson 1. And what are we doing today? Let's look. Again, we're continuing with the immune system, but last week we were talking about the innate immune system, the mucosal lining, inflammation, our skin. So these are things that are we're born with. They don't get developed, and they're just there, just protecting us all the time. The things that we're about to talk about today are the things that get developed. And we're going to be talking about the different types of white blood cells. Where do white blood cells come from? And these are accessory organs to the immune system, which are your lymph nodes, your spleen, and your tonsils, and the location and function of those. And then we're also going to talk about, now last week was, of course, the innate immune system, barrier defenses. Okay, those are the no-brainers. These are the things we're talking about that have to be developed and have to kind of be exposed to exposed to pathogens to work. Not all the time, but it enhances it. So structures of the function of the immune system, types of white blood cells, and the organs or the accessory organs here, lymph node, spleen, and tonsils, and it is in chapter 21 of our textbook. So without further ado, let's go to our main page. Go to our course textbook, which is OpenStax.
Congratulations.
Congratulations for what? Did I win? What did I win?
I'm sorry, Dr. Garais. I'm actually at work and my patient is positive for strep.
Yay! They get to win. Anyone know what medication?
An antibiotic. And
yes, antibiotics, but which one? Which one? Which one are we going to give them?
It depends on the patient's history. It could be
frontline.
It's usually amoxicillin class.
We'll give them a mox. We could.
Augmentin can be a good choice.
That's an entirely, let's not get into that because now we're getting into pharmacology. And as a chemist, it's one of my favorite things to talk about. But today we're talking about immune system, and related to that is, of course, right, your patient's got strep, right? It's a pathogen. And remember the video from Anatomy and Physiology 1 where we were talking about the chain of infection. Your patient, normally, if your patient wasn't sick, wouldn't have gotten strep. But since their immune system is down and the players that we're going to be talking about today, if they're not working to their optimal capability, and the innate immune system that we talked about last week, if it's not working to optimal capability, then something like strep gets in. Now, there's no such thing as good bacteria or bad bacteria. There's only bacteria in the wrong place and in the wrong amounts. A classic example is E. coli. E. coli, your intestines, especially your large intestine and especially your colon, should have a lot of E. coli. It's natural, it belongs there, it helps in vitamin production, it helps in processing feces, but you don't want that stuff on your sandwich, right? So it goes in the wrong place and in the wrong amounts. And we have tons of streptococcus. We have tons of staphylococcus. They're all over our skin, but I don't want them in my blood. I don't want them in my lungs. I definitely don't want them in places like my brain, which is supposed to be sterile. So we have this system here, the lymphatic system. Wherever there's an artery and vein, there's also a whole bunch of tubing, and that's your lymphatic system. The function of the lymphatic system is twofold. One, of course, to bring lymph fluid and white blood cells to an area of need. And two, the lymphatic system also drains any excess fluid from your cardiovascular system. So let's say my cardiovascular system gets all backed up. I need a place to dump all that extra fluid, or I'm going to get edematous, I'm going to get edema, and then I'm going to get all gummed up. And remember, water is a great thing, but if I have too little of it, I'm dehydrated. If I have too much of it, I have edema, and that's bad news. So we're going to talk about the parts. Innate immune response against pathogen, a bad thing. Hello, baby. Welcome to the lecture. And also, we're going to talk about infants. How you got a baby. Last thing you want to do when they're newborn is to bring them to the mall, because remember we talked about the innate the barrier defenses last week. You're born with it, but that's not enough. The stuff that we're talking about today, you won't have when you're a baby, and that's why last place you want to bring a newborn or infant is to the mall. But every time in the past, well, maybe not now, but in the past, how many times there's people want to bring baby to see the world, and for the world to see the baby? Not a good idea to bring them to the mall. And these things that we're going to be talking about today, they're adaptive. They adapt to the environment, and they adapt to the things that could potentially attack our bodies and could be potential pathogens. Okay, so let's next page. And I hope all of you could see it a little bit better from last week. Like I stated before the lecture happened, last week I got this new mega monitor because my even with glasses, I have a hard time reading this little 12.5, 13-inch screen on my laptop. But the problem is when I use the big mega monitor, it makes everything small. But I figured out a way to make everything big, and try to optimize for your viewing pleasure. So we talked about the lymphatic system. They have two functions. One being a backup for fluids, to drain your body fluids, especially from your cardiovascular system. And two, of course, is the immune function. So lymph fluid, right? It's got a lot of things in it, and the one thing that it has a lot of is white blood cells. And you got these lymph nodes. Now, you got to look at the lymph node as an FOB. For all military personnel, you know what an FOB is. It's a forward operating base, right? You put something out there because you want the troops to get to the pathogen, and our troops are our white blood cells. So you want the troops to be ready. And that's why, we all felt this, right? If you have a sore throat or maybe a toothache, maybe you got a little bit of infection in your tooth, or you got a maybe sore throat, you feel your neck, and what do you feel, right? You feel these lymph nodes, you feel these little bumps, and sometimes they're painful. And that's a lymphadenopathy. And we use that sign for clinical reasons. And it's the reason why the doctor, even when you come in for a tummy ache, why is the doctor palpating you or touching you all over the place? Because I want to see where are there positive lymph nodes. Also, the majority of people on this call, if not all, are women. And even if you're a man, you should check your breast tissue every month. And that is your breast self-examination, or BSE. Check the armpits, check your axillary area, because if the lymph nodes are positive, if you feel bumps there that weren't there last month, that is a signal that there's some sort of pathogen. And one of the greatest pathogens that we're most worried about in the breast, especially for our female patients and our female selves, is breast cancer. And that's so if you're not quite sure on how to do a breast self-examination, please, after tonight's lecture, look it up and practice it every month, because early detection is wonderful, wonderful stuff. So if we see here, this is a nice diagram of the lymphatic system. And like I stated, wherever there is an artery, vein, or capillary, there is lymph tissue. And here are the main ones. And you can see here, there are main lymph nodes. You have your cervical lymph nodes here, right? So if I have any infection going on here, right, this is going to act like a forward operating base. I'm going to get all my troops there. So what's going to happen to this base? It's going to start swelling up, and it might hurt a little bit. Here's your thymus located in your chest. We're going to talk about that and its relationship to your memory cells and white blood cells. You have your cervical chain here. This that goes around like this, like a rosary, is your rachitic chain. You have your brachial. You have your pelvic. There's a whole bunch, and there's a reason why the doctor is palpating or feeling certain parts of your body, especially if you have nondescript or very vague, vague symptomology. Now you look at this. It's colored green. It's not green in real life. If you guys recall cutting up the pig, there was like 18 shades of brown and maroon. We use the color green to denote immunology or the immune system or the lymphatic system. And you could see here, right? Red, arterial, blue, venous, and you have all this green all the way around here, and that's lymphatic vessels. So you have your lymph vessels and your lymph nodes, and now you know what they're good for. The beautiful both A and B answer would be A, to soak up any extra fluid, to prevent edema, to prevent high blood pressure, and of course, immune system, to bring the white blood cells and the lymph fluid to where it needs to go. Now, just like, sorry for all the war analogies, just like, these lymph vessels are really wonderful pathways for our white blood cells and the lymph fluid to get to bad things. Just like breast cancer, the cancer can use the lymph vessels to travel and can go places. And a classic example is any metastasis. If you recall metastasis, the change from standing still, stasis means standing still, meta means change. So that's when cancer travels from one place to another. And one way it can do it, through these lymph vessels. What's a really nasty example is, it's rare, but it's called a Crookenberg tumor. I don't know why that popped in my head, but it's rare. It's when my patient has a suspected pelvic tumor. We always check the stomach because there could be a primary cancer starting all the way from the stomach that went all throughout the lymph vessels and then ended up in the pelvic area. That's a classic example on how cancer or pathogens, something that causes diseases, uses these wonderful pathways for their advantage. So we already talked about the barrier defenses. That's last week. Skin, mucous membranes, and what also falls under the barrier defenses is the innate immune response, which are non-specific. And the classic example of the innate immune response that is non-specific is inflammation. Okay. So that's why you get a little cut, you get inflammation around that area. It's to protect, it's an immune response. Now, that innate immune response, when it gets totally out of hand, that's anaphylaxis, and that's an emergency problem. That's a no bueno issue. Now, what's slower but way more specific is the adaptive immune response, and that's what we're going to be talking about today, which the cell types and the soluble factors. And they call them soluble factors because they're usually found in the plasma of your blood. And when you get to learn about laboratory tests, a lot of our immunogens and immunoglobulins, the immune proteins, also known as soluble factors, they are found in the plasma of your blood. So we're going to be looking at white blood cells, right, also known as lymphocytes, and of course some of these soluble factors and how do they adapt to to a potential pathogen. So one lovely chart, which is beautiful, is this chart right here. Now, when you do a CBC or a complete blood count, the three main things that you're going to be counting are platelets, and that's your clotting fat. That's your clotting, right? These little tiny little bits, erythrocyte or red blood cell, and then all of these, which are white blood cells. So when you do a CBC, it takes account of these, account of these, and account of all of these. Now, you may have heard CBC, complete blood count, or maybe you heard this. Maybe the doctor or nurse ordered a CBC with diff, also known as your differential. Now, what's your differential? All the different types of white blood cells. So we have platelets, those clot. Erythrocytes, white blood cells, those carry things like oxygen, carbon dioxide, and proteins and sugar, right? But here are the white blood cells, and there are two types. You have the granulocytes. Let me see if I can make this a little bigger. You see here, they got granules in it. And if you recall your Anatomy and Physiology 1, probably week 3, we talked about, remember lysosomes and peroxisomes? That's what all these little granules are. And this is how I remember it. What do you fill a pothole with? Fill a pothole with granules. So you have basophils, neutrophils, and eosinophils. Now, what does basophil, neutrophil, and eosinophil really mean is basophil, base or basic. It likes a basic pH stain. That's why they kind of call it purple. Neutrophil, something in the middle. Eosinophil, they love that red gram stain, like here, okay? And that's a weird way that I remember it. Basophils, neutrophils, and eosinophils. And we're gonna talk about their function momentarily. And these are granulocytes. Now, your agranulocytes are all these other ones, okay? And you can see, especially, these are your memory cells, T lymphocytes and B lymphocytes. And we call them memory cells because they remember the pathogen and act quicker. Again, another military analogy. Target acquisition is key, especially in immunology. Being able to pick up and know your enemy quickly and to engage your enemy, that's what these guys do. T lymphocytes and B lymphocytes, and then B lymphocytes transform into plasma cells. These things right here, they remember. Now, these things don't. These things don't. Your natural killer cell and your macrophage, NK cells and your macrophage, those are, I want you to think of them like bouncers. And we all been to a club before, yes? Bouncers, well, I can't really say they're dumb because the bouncers that I've had were pretty smart. But the stereotype of the big stupid bouncer. They don't think very much. What is their job? Their job is to kill. That's a macrophage. Phage means eat. Macro means big. And of course, an NK cell, natural killer. So they attack things. They eat things through phagocytosis, where the cell surrounds the pathogen and then engulfs it and eats it. Now, they need to get signaled by who? These guys, usually these guys. But just know that these are all agranulocytes, macrophage, NK cell, T lymphocyte, B lymphocyte, and these are granulocytes. And your differential, or the percentage of basophil, neutrophil, eosinophil, macrophage, NK cell, T lymphocytes, and B lymphocytes can tell us more specificity on what kind of pathologic process is going on. And we're going to show you that in a minute. But right off the bat, I could ask you, what are platelets? They clot. What do erythrocytes do? They're red blood cells. They carry things like oxygen, carbon dioxide. What does all of my white blood cell differential do? Well, that is adaptive immune response. I have granulocytes, basophil, neutrophil, eosinophil. Doesn't that look like a beautiful all the above question? Oh, future reference. This is all these cells come from stem cells, And stem cells are called pluripotent cells. That means they can be anything. And remember the term blast? So hemocytoblasts can be anything. That's why we love, for research purposes, we love, what do you call that? Stem cell research and fetal tissue, because fetal tissue can be anything. But you could see they then turn into what? Highly specific cells, blasts, or development cells. And then they make the more specific cell. And here's a reticulocyte, which is a young red blood cell. So if I'm killing off a lot of red blood cells, guess what I'm going to have a lot of? Retics. So my retic count will be what? High, especially if something's killing off my blood, especially my red blood cell. Okay, so this, good to know for my exam. This, much, much better to know. This, you may need to know it for NCLEX, and definitely for NCLEX, and know and understand that all cells come from what? Blast cells or immature cells. And then they mature, and then they become these cells. So let's look at each one and their importance. Now, the B and T cells, we're going to talk about in greater detail momentarily, but do know and understand that the B and T cells, they are memory cells, meaning to say is they remember the thing that they attacked last time, and so that if they see that pathogen again, they'll attack it even quicker. And that's why the whole world is trying to push through multiple types of incentives the vaccine. Because if I give you a vaccine, right, your B cells and T cells can develop and remember whatever I gave it to you. So, for example, I give you a coronavirus vaccine. I don't give the whole coronavirus, you're going to get sick. But I give you the jacket or the coat or the glycoprotein coat. You know those little studs that, why am I just talking about it? Let me just show you. We all seen this picture, right? Here's one in real life through an electron microscope. But do you see all the stuff on the outside, this red stuff? Those are glycoprotein coats, and they have a chemical signature. So they will act as an antigen or something, a chemical structure that will excite my B and T cells to go do something about it. And they're highly specific. They're like a chemical lock and key. So I know exactly who the bad guys are. Now, what do B cells do? B cells turn into plasma cells, and then they develop these things called antibodies. And if you have antibodies, it will attack anything that will have that antigen. So that is the advantage of being vaccinated. So you don't have to get sick. Your body can then see it or see the jacket and then react to it. Now, the T cells, they don't make antibodies, but they also are an adaptive immune response. What they do is they release soluble factors. They release chemicals. And the chemicals will then do what? Remember these guys before? Macrophage and natural killers? Well, the T lymphocyte will then excite the B lymphocyte to go do stuff. And we already know how they do stuff. They make antibodies, and the antibodies will attack something specific. Well, these soluble factors will act sort of like a chemical whistle. So I like calling T lymphocytes like tattletales. And what's a tattletale? Remember tattletale? Somebody remember in grade school, they would be the first one to tell the teacher, like, "Ooh, Miss Nishu," and she was my like first grade teacher. "Miss Nishu, Nelson's being stupid," right? And what would that do? Chemically, those soluble factors, those proteins that are in your plasma of your blood, they signal the big thugs, the natural killer and macrophage, like, "Hey, this is a bad guy here. Guys, do business." And then they come in They're floating around all the time. They come in and then they phagocytose that cell. So B cells and T cells, think what? It's going to make antibodies to attack a specific antigen. T cells, right, is another example of an adaptive immune response, which they will communicate with other cells using soluble factors. And those soluble factors are proteins that are soluble in plasma, like your immunoglobulins. And we're going to talk about immunoglobulins momentarily, and your interferons. Those are examples of soluble factors. And they're going to tell the B cells, hey, make more antibody. And then they're going to tell the NK cells and macrophages, they're going to tell the thugs, hey, let's go do damage. Now, I mentioned the plasma cells before. They're related to the B cells. They are already B cells that are already transformed and that already have antibody. So the B cells are specific already, but the plasma cells are highly specific. And if you look at here, what I was talking about, B cells make antibodies, T cells have those soluble chemical messengers. The plasma cell is specific, they're antibodies because they belong with the B cell, and the B cell transforms the plasma cell. And NK cell and macrophage, who are they? They're thugs. They destroy things that they're told to destroy. And who tells them to destroy stuff? The antigen presenting cell, which is this T lymphocyte. Now, I went through a lot of stuff. Does anyone have any questions about what I went through? Because I was going pretty fast.
No, I like how you was explaining it, though, Professor, from my standpoint, because I could really understand.
Because that's the way you should be able to explain it to your patient. Because is your patient have your training and knows what a soluble factor is, know what this or that, the other thing is? No. You have to explain it to them. Like I had a professor who said, if you can explain it to a 10-year-old child, then that's the way you should explain it to everybody. Because no one likes all this highfalutin language. And also, when you're on an exam, what will you always go back to? You'll always go back to common sense or your initial common sense. So can everyone see how I can easily take this chart and start asking questions? Right? Oh, my patient is bleeding out and can't clot. Where's the problem? Platelet. Right. Yep. My patient has a very low pulse ox. That means the blood isn't carrying the oxygen very well. It's erythrocyte. And of course, infection and immunologic problem. And we're going to talk about specific instances. That's everybody here. Or if I could say my patient has a granulocyte anemia, then you know it's basophils, neutrophils, eosinophils, right? And just as a side note, again, we try not to do too much pathology, but when you look, AIDS and HIV is big on T lymphocytes. And we're going to talk about T lymphocyte a little bit more specific in a moment. But HIV attacks this. And when you think about it, this thing is connected to this, and it's connected to this. So common sense is, if I'm HIV positive, it goes, I'm going to have a really hard time making antibodies, and I'm going to have a really hard time with an infection when, if I don't have any whistleblowers, if I don't have any people to call out natural killer cells and macrophage, will it fight the infection? No, it won't. And that's why an HIV patient or HTLV patient, which has similar effects, or a patient with severe autoimmune disease, they're missing this. And if they're missing this, you now know they're connected to this and this. Now, isn't that how you also have to look at your, what do you call that? Those concept maps. So if you start looking at things like visually, like a map, it's a lot easier. And if you guys noticed, we're already good 2-3 pages into this chapter. Did I really read anything yet? No, I used pictures because most people are not readers, myself included. Most people are visual learners and they like seeing things. And that's why take your concept maps that are due for your tasks Take them seriously because it teaches you a different way to look at notes and to look at information. Now, where does all this stuff come from? Well, the red blood cells come from red bone marrow. And that's hematopoiesis. If you recall your medical terminology, poiesis means production of, hemat means blood. Now, the T cells, they come from your thymus gland. And your thymus gland, if you recall, let me go back up here. It's here in your upper thoracic cage. Where's the better picture? Yep, right here. Okay. And your thymus cell, of course, is your when you're a baby, that's when it develops. Now, remember, these are adaptive. They have to develop. That's why I had the little story about how you don't bring your newborn to the mall. Okay. And there's the location of your thymus. And think thymus, think T cells. Now, B cells, they call it bursa, but for us, think bone marrow, right? We already talked about bone marrow regarding red blood cells. Bone marrow, the red bone marrow also develops lymphoid tissue, which is your B cells. So for our purposes, think bone marrow, B bone marrow, but you'll see the word bursa derivative on this textbook and other places, and I don't want to get into what that is. We already talked about lymph nodes. Okay, now let's talk about the spleen. If you look here, let me enlarge it a little bit. It's located in your left lower quadrant, and it is a major lymphoid organ in the fact that it does two things. One, it stores extra red blood cells just in case anything happens. So Joey Skeleton here gets, gets into an auto accident and bleeds out a little bit. Well, there's about, I think 60 to 80 cc's, something like that. Let me see if it's written here. Not much, but like 60 to 80 cc's of backup blood is located in your spleen. Now, the second thing, so it's a little backup bag of blood, just in case you lose some of your blood. Now, the other function is that red blood cells, they have like a shelf life about 120 days, and they have to be recycled. And they go through the spleen, and the spleen acts like a filter for the red blood cells, and it removes and recycles all the red blood cells that are near their 120-day shelf life. So the spleen, now you know where it's located. Now you know what it does. Two things. One, extra bag of blood. Two, filters red blood cells. Now, those of you who are familiar with sickle cell anemia and sickle cell disease, if your red blood cells are abnormally formed, it's going to do a number on this filter. And if it does a number on this filter, and you could see here, it's like a nice little fine little filter here, right? You could see how it could damage it, and you could have an itis, right? And you could develop splenomegaly, and which is a common problem for sickle cell disease patients. And when it gets out of hand, I must perform a splenectomy and remove that organ. Lymph nodes, lymphoids. Let's now talk about the tonsils. Where are your tonsils? Well, if you look at here, tonsils, if you recall your anatomy physiology 1, this thing is a uvula. This punching bag, that's not your tonsils. What are your tonsils? And these ones are a little swollen, and they could be gray or yellow when they get really bad. They're not supposed to be this puffy. They're supposed to be like to this level, like here, like that. Now, you got lingual tonsils, your palatine tonsils, pharyngeal tonsils. Just know that tonsils are lymphoid tissues. And why? Well, if you recall the lecture that I had for gastrointestine, and I talked about what is the dirtiest place bacteria-wise on your body. It's not your butt. It's here. your mouth, right? I could smear my patient with feces all day. Nothing, you just wash them off, lots of soap, and hope they don't have any trauma on it. But what happens if I get into a bar fight and I punch this guy in the mouth and he cuts my hand? Well, guess what? I get a tetanus booster. I get broad spectrum antibiotics. I also get a wound culture if the cut is really bad on my hand, because this place harbors a lot of nasty things, bacteria that's potentially pathogenic. And that is why whoever built us perfect and gave us 3 sets of tonsils, 3 sets of lymphoid tissue within our pharyngeal area right here. You have your pharyngeal tonsils, your palatine tonsils, and right here, you have your palatine on the side and your pharyngeal, which is back there. Now, just as a side note, remember the uvula is not a tonsil. Your patients sometimes think that. Your uvula, if you remember your anatomy physiology 1, it's like a rudder that steers food from your hard palate onto your soft palate, down your food tube, which is your esophagus. So when you're looking at the patient, and that's why you have the patient say, ah, right? It opens everything up, opens these up, and then I look at these tonsils, and this particular person, their tonsils are a little bit on the swollen side. I've seen far worse. Sometimes they're almost bloody and they're yellow. Pretty gross. Now, remember I mentioned E. coli? E. coli's got a lot of what? It's in fecal matter. So when we have our mucosa that lines our GI and lines are the inside of our bodies, we have lymphoid tissue that's associated with it. And they're also, they're called Peyer's patches, also known as MALT or MALT, which is mucosa-associated lymphoid tissue. And here, they're called Peyer's patches. Some guy, Peyer's, found them, histologist or MD, who knows. But they found them, and that's in MALT, or anywhere we have mucosal lining. Now, you also have BALT, which is, of course, bronchus-associated. And you also have GALT, G-A-L-T, which is gut-associated, or your lower intestine. So where are we? Okay, barrier defenses, we're here. Okay, B cells, T cells. And the barrier we already talked about last week, skin, sweat. Didn't mention salivary glands, but salivary glands have lysozyme. But the real function of lysozyme really isn't a barrier defense. It acts like it a little bit, but it's usually to break down food more than to protect you against pathogens. Now, normal flora. Remember, there's no such thing as bad or good bacteria, right? There's only bacteria in the right place and in the right amount, because normal flora, if that gets out of hand, especially in your mucosal tissues, can easily become pathogenic. Macrophage. And macrophage, I want you to think macro, big. Okay? They're thugs. And they're all over your body. And in certain parts of your body, they're called certain things like Kupffer cells. But the thing you need to know is macrophage, they're not bright, they're thugs. They respond to what? Chemical messengers. Neutrophil. Now, again, attracted to chemotaxis. Chemotaxis is just a fancy word of being attracted to something chemically, okay? And remember the cytoplasmic granules, they're phagocytic. They have things in it that will break down cell tissue and whatnot. So think macrophage, neutrophil, NK cell, phagocytosis. Things that do phagocytosis are what? Thugs, right? They're not too bright, but they need somebody, and they need somebody to tell them what to do. And that's those soluble proteins that we talked about, those soluble factors. And the examples were interferon, gamma globulins, and also they also respond to the B cells telling them what to do. And in those cells, they have enzymes that will digest, that will eat things, hence the term phagocytosis. Now let's look at the soluble mediators. Now you gotta recognize them by name. In the future, you'll be asked on how they work chemically, but do know and understand that they're highly specific and they're soluble in the plasma of your blood. Hey, how many times did I say that in this lecture? What is that a key for you for your midterm? He said it like 3 times. What are the odds that this is going to come out? It's pretty good. So a cytokine or a chemokine, those are soluble chemical factors and they mediate things, meaning they're the whistle. So if that T cell wants to go, hey, bad thing over here, bad bacteria, bad fungus, bad virus, it latches on, it releases cytokines and chemokines, and the thugs come running. Another example, another type of chemical is our interferons, and they're typically abbreviated IFN. And they tag the pathogen. And that tagging, that chemical tagging, that's just like tattletaling. They latch on chemically to the pathogen or to the bad thing, and they release interferons, they release chemicals, and that's called opsonization. And it screams chemically, hey, bad guy, let's go kill this thing. Complement, that's a whole bunch of proteins in your plasma. Remember, all of these are soluble in your plasma. So where are we going to find them? In your blood plasma. That's why you put it in a red top tube with an SST, you know, that little plastic thing. Why am I describing it? You guys have seen this tube, right? Usually red or tiger top, and it's got this little plastic thing. Well, that tube, its function is for the blood to clot, and then we spin it. And when you spin it, what does the blood look like? It looks like this. And that top part, I want that because that has all the chemokines, cytokines. Hey, wouldn't that be a great question? I put this, I could A, B, C, D. Which is responsible for oxygenation of your body? Hey, these guys are. Which is responsible for like white blood cells and platelets? This thing right here in the middle. Which is responsible for cytokines, chemokines? This thing right here. So now you know why tubes have to be put in certain places. And when you get to your laboratory medicine course or your clinical courses, your med-surg courses, when we show you how to take blood, we'll also show you how to do some basic labs. Okay, and you could also see here the percentage of the dry parts versus the wet parts. And that's part of your CBC. That's called your hematocrit. And that tells me the hydration status of your patient. It's not enough for me to look at you and say, hey, you look hydrated. Nope, I need evidence. And you could see here, here's your typical antibody. They look like the proteins when they go together, they look like little Ys. And the tips of these Y-shaped antibodies, they're highly specific chemically to an antigen. So let's say, for example, this is an invading pathogen, right? It's a bad guy. It has little glycoproteins all on its coat, just like the coronavirus. But what happens? Antibody latches onto it. You have complement system, C1, C2, C4, convertase, then all this other stuff. You don't have to memorize this stuff. Just know that all these chemicals, right? It's going to go signal what? The thugs to come by, and what will the thugs do? They will attack it and eat this bad thing. And who does that? The complement, cytokines, interferons, immunoglobulins. Now, just as a quick review from last lecture, the inflammatory response is non-specific, okay? All the stuff that we were talking about up here is highly specific, okay? So non-specific, and I want you to think inflammation, what are the main cells of inflammation? Mast cells. Now, mast cells, they're just like macrophages and NK cells. They're not too bright. All they know is damage, release histamine. Now, histamine, right? That's that chemical that initiates and then prolongs the inflammatory process. And those of us who have hay fever and allergies know that too much of a good thing like histamine becomes a what? A very bad thing, right? So remember, all of this also has to be in balance. And it makes sense. What does histamine do? It increases blood flow. I want the blood flow to increase here. I want the white blood cells to get here. That's why you're going to have a little edema. You're going to have a bump. It's going to hurt because it's going to start to swell up. And remember, there's arteries and veins and nerves in here. It's also going to be warm. You won't be able to use that area for a while. Didn't I just now describe the 5 characteristic signs and symptoms of typical inflammation? If you know the story, and remember the story for those of you who had me in medical terminology, the story was bug bite. Everyone's got a bug bite, yes? So mast cells initiate the response, release histamine, and what do you have? You have a bump, you have redness, you have swelling, itching and or pain, and of course, the 5th thing, can this area do its job? Nope. It's got to be closed down for a while because why? I need this inflammation to repair this area. Okay. Now, when it gets out of hand, that's when it becomes a problem. Like right now, I'm having gouty arthritis, right? The crystals in my joint don't belong there. And what is it telling the mast cell? The mast cell is like, hey, foreigners here, I don't like it. So I'm going to release histamine and that area is going to swell up and then you have pain, so on and so forth. If I'm right now, I'm feeling my foot, it's a little bit warm. It's definitely swollen and it's definitely red and it hurts like a mother, right? So can I use my foot too well? Nope. And didn't I just now describe the 5 cardinal signs and symptoms of inflammation? Now, why do I say it in the story like this? Like bug bite, like my foot? Because don't you think that's easier to remember something that's happened to you or happened to your patient? If you make it personal, along with making it visual, then how much better will you memorize things? Now, some of you are going to want to read all of this. Well, good luck, but I highly suggest do not, right? Go through it, go through this video and start making your, of course, because it's due next week, start making your concept map, but make your concept map so that, you know, you can start answering questions. Self-recognition. Remember those glycoprotein coats on the bad guys, like all those little nubs that were all surrounding the coronavirus? Well, what if your body can't recognize it and starts attacking yourself? That's a problem. This lack of self-recognition, if your T cells and B cells cannot recognize you as you, they will start attacking your own cells. Hence the term autoimmune disease. Auto, if you remember that prefix in medical terminology, means self. And that's not a good thing. Antigens, antibody, and you could see here, that's all this stuff is proteins. All this stuff coiled and wrapped around, and they're highly specific. So if you looked at all these amino acids, all this in color, they go in a specific sequence. And if they have a specific sequence, don't you think my cells would start recognizing that specific sequence? This should really freak you out that your body has this capability of this level of complexity. Freaks me out. Oh, how's this? How many of you here have like twins in your family or a brother and sister? Can you just give anybody, even if they're a family member, your kidney? Yes or no?
No.
No, you can't. Now, why? Remember, like someone stated once that I forgot what philosopher or what poet stated that, when we were born, whoever created us broke the mold. It's true. Each and every individual on this planet is incredibly specific and incredibly unique. We have a vast, complex series of proteins called your MHC proteins, or your major histocompatibility complex proteins. Okay. Now, all of us have the highly specific. So even if you're twins, we have to see if the majority of them match. And that's what we're doing when we're thinking of like bone marrow transplants or any other transplants of kidneys and hearts and whatever. We have the technology to take almost anything out of one body and put it in the other, but we couldn't figure out, we still haven't mastered yet how to control MHCs. And the way we do it is we dose you up with massive amounts of corticosteroids so we can kind of suppress your immune system. Isn't the greatest idea, but it's the only thing we have. And there's different kinds of classifications. Don't need to know the difference between the two. Just know that major histocompatibility complex and proteins are vital in the uniqueness of your own immunology, and that if you want to donate parts of you to even a close family member, it's hit or miss. I have a good friend of mine. He has kidney disease, and he's crazy young. He's one of my Zumba dancers. And by that, those of you who don't know me yet, I had before COVID, I had a production company that supplied belly dancers, Zumba dancers, and sports dancers for the clubs and Fairfax County public schools. And he's crazy young, 26, 27 years old. And his MHC doesn't match to anybody. And doesn't look good, but he's on the list. We'll see. We cross our fingers. And you can see here, the MHC class matches to certain things. But just know that they're part and parcel regarding the uniqueness of who each and every individual is. This is the thing that I was talking about, APC, or antigen presenting cell, right? Now, let's talk about T cells. Now, you have T helpers, and that's the CD4 cell. And then you have T cytotoxic cells, or T killers, and that's your CD8 cell. HIV and AIDS love CD4 cells. So let's think about that while we're going through this picture. So what happens? Let's say we have something bad, right? Like some antigen, right? Latches on to our CD4 cell or our T helper cell. Well, the T helper cell is an antigen presenting cell. So it's going to release chemicals, and it's going to start chemically screaming to who? The thug, CD8. The CD8 cell will then do what? Will do two things. One, it's going to signal B cells to come to the rescue. And we already know that B cells secrete antibodies. So that's one. And number two, the T killer will do what our CD8 cell will do what it's trained to do, kill, or phagocytose the thing that it's attached to. And that is T cell or cell-mediated immunity. Okay? So again, CD4 acts like an antigen-presenting cell. It latches on something specific from an antibody from a pathogen. And then it signals the killer to do what? To go kill. And it also signals B cells to make antibodies so that the next time we see this joker again, we're going to attack it even faster. Okay? And that's called cell-mediated immunity. And now you can see the problem with HIV and AIDS and HTLV. This is out of the picture. You have nobody telling the killer what to do. You have nobody telling the B cells what to do. And that's bad news. And that means this bacteria or whatever this thing is, whatever this antigen is, will do a lot of damage because no one will stop it. No one's there to blow the whistle. Okay? And you see here, activated T cytotoxic cells, kill, because that's what they do. Cyto means cell, toxic means, of course, not good for the cell or bad for the cell, also known as T killers. So you have CD4, T helper, CD8, T killer. And we monitor very, very closely CD4 cells or T helper cells in our HIV positive and our AIDS community. More pictures of the same thing. Tregs, and you don't need to know, right? But T cell, T cytotoxic, T killer, known as CD8. T helper, CD4, right? And remember, the CD4 not only tells the killer what to do, it tells B cell, it tells, oh, I forgot to mention macrophage. And how does it do it? Remember all the cytokines and all the mediators? Interferon, interleukin, tumor growth factor, beta, right? So these are just some examples. Okay, I think, oh, and this is just more, this is how we draw it diagrammatically, but here's in real life. It's just a bunch of ribbons of proteins. But can you see, use your imagination a little bit? Forms a Y. And this antigen binding site, right? This green and red parts here and this blue and yellow parts here, they are highly specific. Hence the term variable region. And here are your immunoglobulins, which are also soluble proteins, right? You see the IgM, they're huge. IgE is big on inflammation and allergies. Secretory IgA, this in tears and mucus. Antibodies, I want you to think IgG. So you could see there's different kind of proteins, and all it is proteins formed in different ways. And those are classification of antibodies, also found soluble in your plasma. And I can monitor them for certain things, as you can see here. Okay. That's about it. I think we are good on that part. So let's go back, because we always have to check. Did we go over everything that we needed to go over? Let's check. Did we talk about the different types of lymphocytes? Yes, we did. Lymphocyte development in the bone marrow, specifically the red bone marrow. If you recall, the yellow bone marrow dealt with adipose tissue in bone, but red deals with hematopoiesis. We talked about lymph nodes, spleen, tonsils, and the lymph vessels and their functions. We mentioned a little bit of the innate immune system and the barrier defenses. And we definitely dealt with T cells and B cells. And I think we're good. So what is due for next week? And if I look at my handy dandy calculator, also known as my phone, next week is what? The 9th? So what's due on the 9th? This concept map. Now, what's a concept map for those of you who hadn't had me before? You could look it up, Google it, and you could see it's something like this where, you know, our main topic today was what? Adaptive immunity. And then we talked about different things. So you could have, like, make a circle and an arrow, and You could talk about white blood cells and then the different white blood cells. You could talk about the soluble factors and the different kinds of soluble factors. And then another arrow here, you could talk about lymph nodes and lymph vessels. And then another arrow here, you can then talk about, make little boxes or circles about, what was the other thing that we also talked about? We also talked about T cells versus B cells. And there's another thing. Now, if you, because I Google it, and if you still have some trouble in trying to create one, try Microsoft Word. And when you go into Microsoft Word, insert, and here shapes, and then you can insert, like, you know, you can make your shapes here, and then insert shapes again, and then you got your arrows, and you can make it nice and neat. Okay, and you're gonna need this skill set. This class is not the only class that has concept maps. And if you need help, again, Google it. There's several YouTubes, but I'm also available for tutoring and such. So you can shoot me an email or text me, make a formal request. But I think most of you were in my MED110 class. So, and some of you are new. Just try Google it tonight and see, and just try it out. And then I can get some feedback to you if you do it in the next couple of days. Now, that's task 2. What's the discussion? Remember, your discussion, this is discussion 1, sorry, that's due today. Discussion 2, okay. Define what antimicrobial soaps are, and can it cause drug-resistant microbes? Why is this? What should it be done? So some of you look at these discussions like a book report. Like you start answering what is antimicrobial soap, or you start talking about drug-resistant microbes, but you don't answer the question within the context of the class. So we talked about immunity, right? So find evidence, 200 to 250 words at least. Don't make it more than 600. Some of you try to write a book. Remember, quality versus quantity. And it has to have at least one 7th edition APA formatted citation. And if you're not familiar with APA formatting, you can give me a call, but try this. Click up here to the library and the APA resources, or you can go here in the library services and get a call out to Miss Laura De Leon, who's our university librarian. You could do that as well. And that's for discussion 2. Now, lesson 2, lovely videos. Oh, look at this video real quick. Passive versus active immunity. This question is almost always on the NCLEX. This always comes out. Now, forget this lab, but the lab, if you click on it, has these lovely notes. And look at here. Look familiar? It's some of the stuff that we were talking about. So if you like looking at what we were talking about in a more condensed notes fashion, click on this. But what's due? You click on the application assignment. Click on that. Click download case. And woo! Remember a year ago, no one knew what this was unless you were in the healthcare field? Now everybody knows what this was. We know that this is what? A virus. And now you know what these little nubs are on. These are glycoprotein coats that the antibody will recognize as something highly specific. So look at this HIV, and again, another explanation of how CD4 cells and B cells interact, and answer questions 1, 2, 3, and 4 in part 1. Repeat, only answer questions 1 through 4 in part 1. Don't have to answer anything. I mean, answer everything. Answers questions 1 through 4 in part 1. So with that being said, let's go back. Does anyone have any questions on what is due next week? And of course, what's due today? And it goes, I'll look at it later tonight. Task 1, discussion 1, and lesson 1. And for those of you who still don't know where the what's the hoses, the lab form is, you click on this start button. You go at the bottom of the page where it says important documents. And then you go here, this little arrow to lab guides, lab safety. And here's the lab contract right here. I know they hid it. They put it in the most obscure place. You know, I really should just take it and just put it out here somewhere, but you guys are pros. You guys can figure it out. All right. With that said, let me look at who's here. 1, 2, 3, 4, 5, 6, 7, 8 plus me is 9. Let me see if I have everyone. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5, 6, 7. Wait a minute, I'm missing one person. No, I'm not. I got all of you. All right. It's at this portion of the show. I am going to